If your doctor has ever told you that a GLP-1 medicine like Ozempic, Wegovy, or Zepbound could help you, but you took one look at the price and just walked away, I need you to stay with me for the next few minutes. Because starting this month, Medicare rolled out something brand new. It's called the Medicare GLP-1 Bridge Program. And under this program, some of these same medications that used to cost $800, $1,000, even over $1,300 a month, could now cost you $50 a month instead. $50 instead of over $800. I'm not exaggerating, and I'm not selling you anything. This is a real program from the federal government, and I'm going to walk you through exactly what it is, who it might help, and exactly what steps to take. No scare tactics, no guessing, just the facts, straight from Medicare and CMS, explained in plain English. Let's get into it. Stick around because I'm also going to tell you about a couple of things people misunderstand about this program right out of the gate. The kind of misunderstandings that could actually cost you time or cost you money if nobody explains them clearly. So even if you think this doesn't apply to you, give me a few minutes before you decide that for sure. Here's why I wanted to make this video. For years, I've heard from people in your position. Folks on Medicare who heard about these weight loss medications, maybe even had a doctor recommend one, and then found out their Medicare drug plan simply would not cover it. Not because the plan didn't like them, because the law didn't allow it. That's a hard thing to hear. You did everything right. You have Medicare. You have a prescription drug plan. And still, the answer was no. This new bridge program doesn't erase that history, and it doesn't fix everything. But it does open a door that's been closed for a long time. And because this is a brand new program, a lot of people simply don't know it exists yet. My goal today is simple. Make sure you know it exists, know whether it might apply to you, and know exactly who to call to find out for sure. I also want you to know something about how I put these videos together. I only use official government sources, Medicare.gov, CMS.gov, and information directly from the agency that runs this program. I don't guess at numbers, and I don't repeat things I saw floating around online without checking them first. If I'm not sure about a specific detail, I'll tell you plainly, and I'll point you to where you can go verify it yourself. That's a promise I make to you at the start of every single video on this channel. Let's back up for a second, because understanding the old rule helps the new program make a lot more sense. For a long time, federal law said Medicare Part D, that's the part of Medicare that covers your prescription drugs, could not pay for medications if they were prescribed only for weight loss. It didn't matter how much a doctor believed it would help you. If the prescription was written purely for losing weight, Part D's hands were tied by law. Now, GLP-1 drugs, the class that includes medicines like Ozempic, Wegovy, and Zepbound, could sometimes be covered if they were prescribed for something else, like type 2 diabetes. But if your reason was weight loss, you were often stuck paying the full retail price yourself, out of your own pocket. And that full price is steep. We're talking somewhere between $800 and $1,300 a month, sometimes more, depending on the specific drug and pharmacy. For someone living on a fixed income, that's not a monthly expense. That's simply out of reach. It's worth saying clearly, this wasn't because Medicare didn't care. And it wasn't because your specific plan was being difficult. It was federal law. Changing that kind of rule takes an act of Congress, or it takes a federal agency using its authority to test something new. That's exactly what happened here, and it's exactly why this new program is such a meaningful shift. That was the old rule. Now let's talk about what changed. On July 1st, 2026, the Centers for Medicare and Medicaid Services, most people just call them CMS, they're the federal agency that runs Medicare, launched something new called the Medicare GLP-1 Bridge Program. Think of the name literally. It's a bridge. It's a temporary pathway that lets certain Medicare Part D enrollees get access to certain GLP-1 medications at a much lower fixed cost, even when the medication is being used for weight loss. This is what's called a demonstration program. That's a term worth understanding because I'll come back to it later. A demonstration program is something the government tries out for a set period of time to see how it works before deciding whether to make it permanent. This one is scheduled to run from July 1st, 2026 through December 31st, 2027. That's important, and I don't say it to alarm you. I say it because it's true, and you deserve the real picture. This program has a defined window right now. It may be extended. It may become permanent down the road. Nobody can promise that today. What we do know is that right now, during this window, this door is open. I'll say this once clearly, and I'll say it again later because it matters. Nobody, including me, can promise you what happens after December 31st, 2027. What I can promise is that I will keep watching this program, and if anything changes, this channel will be one of the places you can come back to for a clear, honest update. Let's slow down and really look at the numbers, because this is the heart of the whole story. Before this program, if you needed one of these medications for weight loss, and your Part D plan couldn't cover it, you were looking at somewhere between $800 and $1,300 a month, or more, straight out of your pocket. Multiply that by 12 months, and you're talking about a serious chunk of a year's income for a lot of retirees. Under the new Medicare GLP-1 Bridge Program, eligible medications are capped at $50 a month in copay for people enrolled in Medicare Part D. Let that sink in for a second. $50 instead of $800 to $1,300 or more. That's not a small discount. That's the difference between a medication being completely out of reach and a medication being something you can actually plan for in your monthly budget. I want to be very clear about something though. This $50 cap applies to eligible GLP-1 medications under this specific bridge program. It is not a blanket discount on every medication, and it doesn't automatically apply to everyone with Medicare. I'll explain exactly why in a few minutes. I know some of you have sat through videos before that throw out a big, exciting number and then bury the fine print at the very end, almost hoping you won't notice it. That's not what I'm doing here. I'm telling you about the fine print right now, early, because I'd rather you have the complete picture from the start than feel like you were misled by the time you reach the end of this video. So who is this actually for? This program is designed for people enrolled in Medicare Part D, whether that's a standalone Part D drug plan or a Medicare Advantage plan that includes drug coverage, who have a doctor's recommendation for a GLP-1 medication and who meet the specific medical criteria for the program. If you've been told by your doctor that one of these medications might help you, and you've been putting off asking about it because you assumed it simply wasn't affordable, this is exactly the kind of situation this program was built for. I also want to speak to something important. This program is specifically about medications being used to reduce excess weight and help maintain that weight loss. If you're already receiving a GLP-1 medication through your Part D plan for a different approved reason, for example, type 2 diabetes, that coverage continues to work the way it always has, through your regular Part D benefit. This bridge program is a separate pathway, specifically opening up access for the weight management use that used to be excluded. I want to be gentle but honest here because I know weight can be a sensitive subject for a lot of people, and it's not something I take lightly. This program isn't about anyone's appearance. It's about whether a medication your own doctor believes could support your health is something you can actually afford to use. That decision belongs to you and your doctor, not to me and not to anyone else. Let's talk specifics, because I know some of you are wondering exactly which medications we're talking about. The GLP-1 Bridge Program covers select GLP-1 medications when they are prescribed to reduce excess body weight and help maintain that weight loss. This includes medications in the same family as Wegovy and Zepbound, brand names you may have already heard about, maybe from your doctor, maybe from the news. Now, medication lists and specific formulations can be updated by CMS as the program moves forward. So rather than me listing out every exact brand and dosage form here and risk giving you outdated information a few months from now, here's what I want you to do instead. Ask your doctor directly which medications qualify under the program, or check the official details for yourself at medicare.gov. That way, you always have the most current, accurate list. I'd rather send you to the source than hand you a list that might be a version behind by the time you're watching this. Medications, dosage forms, and program details are exactly the kind of thing that can be updated as CMS gathers more information. So treat your doctor and Medicare.gov as your two most reliable, up-to-date answers. Here's something that surprises people, so let me explain it clearly. This program doesn't run through your regular Medicare Part D drug benefit the way your other prescriptions do. Instead, the Medicare GLP-1 Bridge operates as its own separate pathway. Your doctor submits the prescription and the necessary paperwork, and it gets processed through this Bridge program directly, rather than through your everyday drug plan's normal process. What that means for you, practically speaking, is this. Your Part D plan doesn't have to specially sign up or opt in for you to use this program. The pathway exists at the federal level. But it also means the way you access it is a little different from how you'd fill any of your other prescriptions. I know that can sound complicated when I describe it out loud. Here's the simple version. You don't need to figure out the plumbing behind the scenes. Your job is just to talk to your doctor. Tell them you're interested in the GLP-1 Bridge program, and let them help guide the prescription and paperwork through the right channel. That's what they're there for. Doctors' offices deal with insurance paperwork every single day. This may be a newer program to them, but navigating approval processes and special pathways is genuinely part of their normal routine. You don't need to become an expert in claims processing to benefit from this program. You just need to start the conversation. Now let's talk about something I really want to make sure sinks in, because I don't want anyone watching this to walk away with the wrong idea. This program is not automatic. Just because you have Medicare Part D does not mean you are automatically enrolled, and it does not mean every GLP-1 medication is automatically $50 for you. Two things have to line up. First, a doctor has to determine that a GLP-1 medication is medically appropriate for you, based on specific criteria the program sets out, things like your weight and certain health factors. Second, the prescription and any required approval have to be properly submitted through the program's process. If you already get a GLP-1 medication through your Part D plan for something like diabetes, this particular $50 bridge pathway isn't the one you'd use. Your existing coverage keeps working as it does now. So please don't assume. Don't assume you qualify, and don't assume you don't. The only way to know for sure is to have an actual conversation with your doctor and check directly with the official Medicare resources. I'll tell you exactly how to do that in just a moment. I say all of this because I've seen what happens when people hear an exciting headline, assume it applies to them automatically, and then feel discouraged or even a little embarrassed when it turns out their specific situation is different. There's no need for that here. This is simply a program with real criteria, like most Medicare programs have, and checking those criteria is appropriate recognition. If there's one single action step I want you to remember from this whole video, it's this one. Start with your doctor. Your doctor is the one who can look at your health, your history, and your goals and tell you honestly whether a GLP-1 medication makes sense for you. They're also the one who understands the specific medical criteria the Bridge program requires, and they're the one who would submit the prescription through the right process if you qualify. So when you go in for your next appointment, or even if you call the office before then, say this clearly. I heard about the new Medicare GLP-1 Bridge program. Can we talk about whether a GLP-1 medication might be right for me, and how I'd go about using this program if it is? That one sentence puts the ball in motion. Doctors and their staff are hearing about this program too, and many offices are already getting familiar with how to help patients through it. You asking directly is often the fastest way to get real answers. If you have an upcoming appointment already scheduled, this is a perfect thing to bring up then. If your next appointment is months away and you feel like this is worth discussing sooner, it's completely reasonable to call the office and ask if this is something that can be addressed over the phone, through a patient portal message, or at an earlier visit. After you've talked to your doctor, I want you to also double-check things yourself using official government sources. Not a random website, not a sponsored ad, not somebody's opinion in a comment section, official sources only. The two websites I trust, and the two I want you to trust, are Medicare.gov and CMS.gov. These are the official U.S. government websites for Medicare and the Centers for Medicare and Medicaid Services. They will have the most current, accurate details on the GLP-1 Bridge program, including updated eligibility criteria and any changes as the program continues. I know navigating a government website isn't always the most fun way to spend an afternoon. But when it comes to your health and your money, official sources matter. Bookmark Medicare.gov. Come back to it if anything about this program changes down the road. because with a demonstration program like this one, details can be updated as CMS learns more. Here's another resource I want to make sure you have written down, because it's simple and it's free. 1-800-MEDICARE. That's 1-800-633-4227. This is the official Medicare helpline, and you can call it with specific questions about your own situation. Ask them directly. Am I eligible for the Medicare GLP-1 Bridge Program? What do I need to do? They can help walk you through your specific plan and circumstances. I want to gently point something out. Sometimes when new programs like this launch, other groups try to take advantage of the confusion. Cold calls, pushy sales pitches, offers that sound official but aren't. If anyone contacts you out of the blue promising instant approval or asking for payment up front to lock in this rate, that is not how official Medicare programs work. When in doubt, hang up and call 1-800-MEDICARE yourself using the number I just gave you, or the number on the back of your Medicare card. Your real path here is simple: your own doctor and the official Medicare number. That's it. Let's pause here for a second and bring it all back together, because I want to make sure this sticks with you. Before this program, GLP-1 medications for weight loss could cost $800 to $1,300 a month or more, straight out of your pocket, with no help from Medicare Part D. That's the old reality a lot of you have been living with. Now, under the new Medicare GLP-1 Bridge Program, launched July 1st, 2026, eligible medications are capped at $50 a month for qualifying Part D enrollees. $50 instead of $800 to $1,300. That's not a small change. For someone who genuinely needs this medication and has been priced out for years, this could be the difference between going without and actually getting the treatment your doctor recommended. But remember, it isn't automatic. You have to check. Your doctor has to confirm medical necessity, and the prescription has to go through the program correctly. So if you've made it this far in the video, you already have more information than most people currently have about this program. Let's keep going, because there's a bit more you need to know. I mentioned earlier that this is a demonstration program, and I want to come back to that because it matters for your timing. The Medicare GLP-1 Bridge Program is scheduled to run from July 1st, 2026 through December 31st, 2027. That's the current window. It is not guaranteed to continue past that date. The government uses demonstration programs like this one to study how a new approach works, how many people use it, how it affects health outcomes, how it affects costs, before deciding whether to make something permanent, extend it, or let it end. I'm not telling you this to rush you into a decision you're not ready for. Nobody should start a new medication just because of a deadline. That's a decision between you and your doctor, based on what's right for your health. What I am saying is this: if you've already been told by a doctor that a GLP-1 medication could genuinely help you, this is a meaningful window of opportunity. And it makes sense to have that conversation with your doctor sooner rather than later, simply so you know where you stand while the program is active. Let's talk honestly about who this program might not apply to, because I'd rather you know the full picture than get your hopes up incorrectly. If you're already receiving a GLP-1 medication through your Part D plan for an approved medical reason, like type 2 diabetes, this bridge pathway isn't the route you'd use. Your current coverage continues as it is. If a doctor has not recommended a GLP-1 medication for you, this program doesn't create automatic access just because you're curious about it. Medical necessity, determined by your own doctor, is part of how eligibility works. And if you're not currently enrolled in a Medicare Part D plan or a Medicare Advantage plan with drug coverage, this specific pathway wouldn't apply to your situation either. None of this means the program can't help you. It very well might. It just means the only way to know for certain is to have that direct conversation with your doctor and to verify your specific situation with Medicare directly. Don't assume yes and don't assume no. Just go check. Let me give you some simple, specific things to say and ask, so you walk into that doctor's appointment feeling prepared, not confused. You might say, I saw that Medicare has a new GLP-1 Bridge program that could bring the cost of certain weight loss medications down to $50 a month. Do you think I'd be a good candidate for one of these medications? And can you help me use this program if so? You could also ask, if I do qualify, what happens next? How does the prescription get submitted? And how will I know if it's approved? And if your doctor's office isn't familiar with the program yet, that's okay too. You can say, I read about this on Medicare.gov. Could we look into it together? You are allowed to be the one who brings new information to the table. That's not overstepping. That's advocating for your own care. And it's exactly what this program was designed to make possible. I want to be fully transparent with you about one more thing, because I never want to leave out important details just to make a story sound simpler than it is. The $50 figure refers to the copay under the Medicare GLP-1 Bridge Program specifically for eligible medications accessed through this pathway. As with anything involving your specific Medicare plan, the full details of how costs apply to your individual situation can vary, and official guidance can be updated as the program continues. This is exactly why I keep steering you back to your doctor and to Medicare directly, instead of me trying to guess at every possible detail for every possible person watching this video. Your situation is your own. A 5-minute phone call to 1-800-MEDICARE or a conversation at your next doctor's visit will give you a clear, accurate answer far better than any general video ever could. Zoom out with me for a second. This program represents something bigger than just one medication or one price tag. For a long time, weight-related health treatment was treated differently than other medical treatment under Medicare, in terms of what could be covered. This bridge program is one of the first real federal steps toward closing that gap, even if it's temporary and even if it's limited to a specific window of time. That matters. Not because of politics, not because of any opinion I'm going to share with you, but because of what it could mean for real people. Someone who was told for years there was simply nothing Medicare could do to help with the cost of a medication their doctor recommended. For the first time, there may be a real answer. Whether or not this becomes permanent after 2027 is something we'll have to watch together. And if you're subscribed to this channel, you'll be the first to know if anything changes, because I'll be right here covering it. Let's bring it all together with a simple checklist. Here's exactly what I want you to do this week. Step 1. Talk to your doctor. Ask directly about the Medicare GLP-1 Bridge Program and whether a GLP-1 medication might be appropriate for you. Step 2. Verify everything yourself at Medicare.gov and CMS.gov. These are the official sources, and they'll have the most current, accurate details. Step 3. If you have specific questions about your own plan or situation, call 1-800-MEDICARE. That's 1-800-633-4227 and ask them directly. Step 4. Remember, this isn't automatic. Coverage depends on medical necessity determined by your doctor and on properly using the program's process. Don't assume either way. Go find out for certain. And step 5. Remember the number that started this whole video, $800 to $1,300 a month, potentially down to $50 a month for those who qualify. That's worth 5 minutes of your time to check. I make these videos because I genuinely want you to have the same information that everybody else has access to, explained clearly, without the jargon, and without anyone trying to sell you something you don't need. Medicare changes. New programs come and go. And honestly, most people never hear about them until it's too late, or they hear about them from someone who gets a few of the details wrong. My goal is to be the person who gets it right, and gets it to you early. If this video helped you, or if you think it might help a neighbor, a sibling, or a friend who's also on Medicare, please consider subscribing to this channel. I cover real Medicare and Social Security benefits, explained honestly, with no scare tactics and no fluff, and I'd love for you to be here for the next one. And most importantly, if a GLP-1 medication has ever been on your mind, don't let that conversation wait. Call your doctor or call 1-800-MEDICARE and find out where you stand. Take care of yourself. I'll see you in the next video.